Thanks. Yeah, it's an amazingly rapid evolution that we've seen in the last 2 to 3 years. Going back again to renal cell, we had interferon, followed by interleukin-2, followed by the Death Valley. There was nothing from 1982 until 2004, 2005. I still remember the exciting ASCO of 2004 and 2005 when we had sunitinib reported and sorafenib reported, and suddenly the world opened up. And then subsequently up to 8 new agents, Avastin and who knows what else, pazopanib and so on. So we then were, if you will, almost inundated with options for what to do, how to do it. And we were getting pretty good at it. We had the COMPARES trial in the New England Journal of Medicine, again by my colleague Bob Motzer, showing that there was equivalence of those 2 agents. And so there's been a bit of a shift from sunitinib to pazopanib, but still pretty equivalent use and not clearly one being better than the other. And so as we're beginning to think we know what to do, suddenly comes PD-L1 and PDL, and patients are getting benefit. And you're going, okay, now where do we fit this in? So we used to say pretty simply, well, you do a sunitinib or pazopanib, followed by either another TKI or followed by an mTOR inhibitor, and then it's dealer's choice. But now, at this ASCO meeting, we saw data suggesting that you can give PD-L1 or PDL with pazopanib or with sunitinib. There may be some added side effects, but we might be able to give them simultaneously or immediately sequentially. And there appears to be a pretty long duration of benefit with these nivolumab agents. The meeting I just left had the combination of nivolumab and ipilimumab, and darn, that looks pretty promising. So where we're going to fit all these together, I'm not sure. We don't know yet. One of the topics yet to be figured out is how do we prevent these tumors from coming back? You remove the kidney, and they've got a relapse rate pretty high, 30, 40, 50, 60%. And we've done trials with sorafenib and sunitinib and pazopanib, and now we're doing a trial with axitinib, and none of the trials have yet shown a benefit to prevention. So now we're going to launch into PDL, PD-1 adjuvant trials. So the world is to be recreated in the next few years.